again. Hello, hello, hello. Thank you for joining us to the IDEA panel for the Pheo Para Awareness Week. IDEA, the acronym for IDEA stands for Inclusion, Diversity, Equity, and Accessibility. I am super excited. My name is Saadia White, known as the Amazing Amazon and author with a cause. I am your moderator for this evening, but most importantly, I am also a patient who has survived a pheochromocytoma. I am here with several of my panelists, other superheroes who are uniting to come to the forefront. I can't wait. I'm so excited. So we have Layla Adrianowska. We also have Tina Price. We also have Shada Snyder. And we also have Dr. Emmanuel Gabriel, where I'm going to allow each person, each panelist to introduce themselves. But before I do this, I just want to tell you that this program is being brought to you by the Pheo Para Alliance, whose mission is to empower patients with pheochromocytoma or paragangliomas, their families and medical professionals through advocacy, education, and global community of support while helping to advance research that accelerates treatments and cures. We want to give a special thanks to Progenics for their support of our third annual awareness week. Isn't that exciting? Y'all give us a round of applause. That's exciting. Let me see the questions. Awesome. I want to mention, before I get started, I want to mention how you can be involved with our Pheo Para Awareness Week. There are plenty of ways that you can participate. Okay, all of the info can be found at the pheopara.org. Again, that's pheopara.org, and someone will put that in the chat, and you can share the links on our social media pages. This week, we are also hosting our Pheo Para virtual conference, which includes educational sessions featuring world-renowned clinicians and researchers discussing various Pheo Para topics. You can register for this conference and a few of the sessions using the link that you'll see in the chat. So, plenty of ways for you to help us spread the awareness. This is such an important discussion, and the Pheo Para organization is amazing. Okay, I just want to give you a disclaimer too that the information presented on this webinar is for educational purposes only. The content of this program is not influenced by any of our sponsors or supporters, okay? So with that being said, let me give you a little bit of background on the IDEA Committee formation. The IDEA Committee's mission, and again, we decided to go with IDEA because we wanted to include accessibility. So inclusion, diversity, equity, and accessibility. That's what the acronym stands for. And our mission is cultivating a transformational approach to inclusion, diversity, equity, and accessibility through a multi-dimensional lens that encompasses underrepresented communities, which can include, but isn't limited to, ethnicity, national origin, gender, socioeconomic status, sexual orientation, age, and religion, and regardless of ability. Our goal is to create an equitable culture for all pheochromocytoma and paraganglioma patients and all those supporting our patients, including caregivers, healthcare providers, and researchers. Yay! I'm glad I got through that mouthful. That was a mouthful, y'all. So we're going to go ahead and get into, this is a very necessary conversation as it pertains to IDEA. You know, since 2020 really began with the hot climate of what they call DEI. Again, we added the A, so ours is idea. But it was a very, very hot climate as it pertains to that topic. And as we know that this could be very sensitive and it's very uncomfortable sometimes. So we want to really be aware when we're discussing and answering these questions and giving our stories of everyone that's in the room and those of us who will be listening and for future references. Let's be respectful to each and everyone's story and how it originated. You know, everyone has a different challenge as it pertains to idea. And we just want to definitely have a united front as it pertains to this uncomfortable topic, but we're going to make it as comfortable as we possibly can. Now I'm going to reveal myself. Ready? 1, 2. Okay, I'm geeked up on a lot of coffee, y'all. Let's go. So I want to go ahead and have each one of our panelists introduce themselves and give just a portion, share a portion of their story as it pertains to what they went through along their journey as either a patient, a caregiver, or even like our medical provider that will be in the room shortly. So I'm gonna go ahead and start with Layla.
Okay, hi everyone, I'm Layla. I'm from Toronto and I had a pheochromocytoma in my right adrenal gland. It was diagnosed a few days after my 19th birthday. So I was just like old enough to not get like a children's hospital. So I kind of am going to be representing the age section and how that impacted my diagnosis. And sorry if you hear my dog snarling. I have a Chihuahua who likes to snarl, so she might be snarling in the background. So yeah, my age had kind of added an extra layer of difficulty. And then I also, unlike many younger people, I don't have any genetic mutation. We've tested it like 3 times, so many different genes, more than just the Pheo panel. So that also adds another layer of difficulty.
Thank you, Layla. Thank you for sharing that with us. I'm going to move right along to Tina.
Thank you. So my story pertains to my mom. I was one of her caregivers, my sister and I. She had a disability where she'd had a brain injury after a surgery many, many years ago in the 1980s that left her unable to speak words. So she was aphasic. She could make sounds but couldn't communicate with words. And mentally, she was probably very similar behaviorally to like a 3 or 4-year-old in terms of her ability to comprehend what was going on around her. But she had a fantastic life. She was the happiest person I've ever met. She's very physically able. She lived at a facility that was beautiful in this amazing place. But her experience coming into being diagnosed with idiopathic hypertension for a couple of years, which apparently wasn't, and then abdominal pain where they found a mass, para-aortic, turned out to be a paraganglioma that was functional. And her experience, and like through my eyes of being her caregiver and in the room virtually with her doctors at the time, the experience of going through that diagnostic process was really different. As someone who was not able-bodied, their experience compared to, say, if I had gone in, being able to communicate freely for myself. So that's part of my story. My mom has an SDHB mutation. I do not inherit that, but my sister, 3 of her children, and my sister's granddaughter all have the SDHB mutation.
Wow.
Thank you.
Thank you, Tina. Thank you for that. Next, we will have the lovely Dr. Shauna Snyder.
Hi, thanks, Saadia. Hi, everyone. Thanks for coming. I'll introduce myself. So yes, Dr. Shauna Snyder. I, for a long time, have been an associate professor of health and wellness. But most recently, I took a job in another rare disease of mast cell disease. So I work for the Mast Cell Disease Society. And I'm also a board member on our Pheo Para Alliance. So if you ever need anything, feel free to reach out by email. I believe my email is out on our website. But a little bit about my story is after years and years of symptoms that doctors really couldn't quite figure out because they weren't really bad. I was still very functional, very active, probably, over the top energy. Of course, now we know why. I actually had a tumor that was giving me that extra energy. But for a lot of years, I had a lot of different symptoms. And then in 2018, those symptoms really started to ramp up. They got completely out of control. And what I started to notice was that every time I went to the bathroom, I would have a massive attack, basically. So I'd almost pass out, my blood pressure would spike, my heart rate would go crazy. I'd go full sweating. It was really crazy. And then after a time, those symptoms kind of never went away. And so in my research background, just because of my job, I began to do my own research. And so I figured out what I believed that I had. And I was telling doctors, I think I have a pheochromocytoma, and no one believed me. No one believed me. And so finally in 2019, after I had been in the emergency room 5 times in 1 week, the week of 4th of July, I finally had an emergency room doctor believe me and give me the CT that I had been asking for 6 months. And sure enough, the CT came back that the paraganglioma was in my bladder. And so that's why I was having the symptoms. And I had figured out that I thought it was in my bladder. And so finally we got the CT that proved that I was right. And from there, there's a little bit more of a story, but from there I wound up getting myself into the NIH. And so my doctors are all at the NIH. I had surgery at the NIH, and I'm doing pretty well right now. So I have been this route. Some of you in here may have a similar story, I imagine.
Awesome. Thank you, Dr. Shauna, for sharing with us. And last but not least, we have Dr. Emmanuel Gabriel on. Please introduce yourself and share a little bit about yourself, Dr. Gabriel.
Hey, sorry I'm late. I tried the Google Meet link first and I don't know what's going on. And I'm still at work and I'm at a computer that doesn't have a really good camera. So I apologize for not being able to, interact visually. But okay. I work at Mayo Clinic. I'm a surgeon in Florida. I'm a surgical oncologist. And as you guys know, pheochromocytoma and adrenal tumors are uncommon. So I don't have many patients, that we treat that happen to come through. But when they do, we try to take care of them as best we can. Listening to Dr. Snyder, that sounds like a very, very complex way to present. And so I have not seen something like that, your case before. Usually they're more straightforward, but I'm glad that, you were able to advocate for yourself and get taken care of. As you know, it can be a difficult diagnosis to make sometimes. The surgery can be sometimes difficult based on the location. And I think that, with awareness and the idea of diversity, equity, inclusion, Saadia and I have talked previously that I do think there are disparities and inequities in how different populations get treated. So I'm happy to hear your thoughts about how to, work through this and bring more equity to this disease. Thanks.
Yes, and if you all didn't know, I am so excited to state that Dr. Gabriel was my surgeon. And I am so thankful that I was able to meet with him because he definitely changed my view and my perspective as how medical providers would care for you. Because my first encounter when I was first diagnosed, and this is my story to share, I came into this situation because I kept having these headaches, my blood pressure kept spiking. I had these outrageous pulse rates, and I don't know, everything was off. I was feeling like I was having panic attacks. And basically every time I went into the emergency room, I felt shame because I felt something was wrong and no one was giving me the proper diagnosis. And I was saying to myself, something is not right with me. It's not normal to have an irregular pulse. It's not normal for me to always feel like I'm in a fight or flight situation. That's not normal. What is happening here? So and about the end of 2019, there was a MRI done, a scan done, and it saw something on my adrenal gland. And actually, they thought it was on my kidney. And through further observation with one of the doctors at the internal medicine clinic where I was going, he asked that I go see an oncologist, urologist. So I did do that. And the oncologist, urologist at the time, I guess he had no prior patients with what had come back, which he had diagnosed as a paraganglioma in the beginning. And he basically just told me that I can't help you. I mean, literally, that's what he said. I can't help you. I've never had a patient with something like this before. And he did not give me any resources, nor did he share with me like, okay, well, I may not be able to help you, but I'm going to look at some of my colleagues. Maybe someone can tell me something. Like, there was no sort of exchange there. It was just like, you have this. I've never dealt with a patient with it. You're going to have to, and basically he told me, you're going to have to do your research, get someone who is qualified. Where I guess in my situation, I felt like when I left there, I was devastated. That's I was feeling lonely. I felt like, wow, this is it? But thankfully, I have resources and people in my family, and there are friends of mine that are in the medical community. You know, my sister and her husband, they're both doctors. So I had them readily available to go to. They were my resources. But in the back of my head, I kept thinking, what if I were somewhere else in a different situation, wasn't educated, didn't have the resources, didn't have these people readily available in my life to kind of point me in the right direction. And I was really hurt by the response that I received from my doctor at that time. So I did do my own research. I reached out to my sister, and she gave me a listing of hospitals that I could connect with. And unfortunately, because we were going into the pandemic at this point, there was no one who can see me immediately. I couldn't find an endocrinologist because I needed one. And there was just so many issues with that. So fortunately, I went to the Mayo Clinic in Jacksonville, Florida. I reached out to them, and they reached back, and they recommended one surgeon at first. That surgeon was very upfront. He said, I've never had a patient with your diagnosis, in which I see it to be not a paraganglioma, but more of a pheochromocytoma. So I want to point you in the right direction. Point you in the right direction, is when he led me to Dr. Gabriel. And I'm so thankful for that encounter, because I really, for months, almost a year, I was led in the wrong direction. And leading up to getting the diagnosis, I mean, there were multiple times where I had went into the emergency room, and I think they looked at me and they're like, oh, she's back. And that's how I felt. I almost didn't want to go back to the emergency room, because I felt as though, wow, every time they look at me, they're looking at me like, does she just want drugs or some type of opioid? So I told my husband, I said, I don't want to go back. I don't want to go back to the emergency room, because no one's helping me. No one's telling me what is wrong. They're looking at me as a one-way situation. And I said, I don't know if it's that they think that I want drugs. I don't know what it is, but I don't want to go back. So I did feel uncomfortable. I did feel discriminated against. I did feel that there was a lot of bias towards me as a Black woman. And I don't want anyone to ever have to feel what I felt. So that is a part of my story. And that's why I'm so, I feel the honor to moderate this panel, because this deeply touches me, the person who I am. And I'm sure that every one of us has a story. So I want to go ahead and get into it. That was my touch on things. I'm going to go ahead and get into the first question, which is, and I'll point this to Layla, because I know Layla is the youngest on the panel. And with IDEA and DEI, you know, that age is definitely one of the factors of discrimination. So we know this, and that's the reason why I'm going towards Layla. I'm going to go to you first, Layla. So my question for you is, did you feel misunderstood by the medical community? And how did this impact your care, time, your care, your diagnosis time, and access to your research and treatment?
So the answer is definitely yes, it made a difference. I think when I first got diagnosed, it was so severe, like my blood pressure had gotten so bad that they couldn't ignore it. So I always wonder how I would have been treated if my blood pressure wasn't that extreme and they could have easily dismissed it. Because that's kind of what I did to myself my whole life. I was like, oh no, it's headaches and just being a little bit weaker than people, that's normal. So I was definitely not at a point where I was going to advocate for myself, because I could have easily been convinced that it was just stress or something. So it was really my blood pressure that helped get my diagnosis so fast and not be dismissed. And I had this great experience with my surgery and my diagnosis, and I thought, how could anyone have problems with this? Like, it was so straightforward, but that is so, like, so far from the truth, because now after my surgery was 3 years ago, and I'm still not feeling better at all. Like, all my symptoms have just been getting worse since then. So now I'm having the trouble getting the help. So I think people look at both my age and then combined with the fact that I don't have a genetic mutation, they're like, no, there's no way there could be another one. So there's just a couple different factors. And then just in general, like earlier this year, I had really bad chest pain, and that usually, like, I don't usually go to the ER for things. I just kind of like say, oh no, it's probably nothing. But, you know, chest pain can be a little more serious, especially with a pheo, or what I just have pheo symptoms. So I don't know if I have one or not. So at the ER, I was like completely dismissed. Like, I really think it is because of my age, and because it was chest pain. They're like, oh, come on, like, what could it possibly be? But they don't understand how real the possibility of like more important issues with the heart that can occur with pheos no matter the age. So there's been a lot of little things that have impacted that.
Wow. And that to me would seem like, if you're coming in as a young person, that also, to me, I would think that, you know, a lot of the, the medical providers will look at that like, this is strange, right? Like, this is strange. Why is this young person coming here with such, you know, her blood pressure being so high? So I would think that would be a light bulb to go off to say, let's get these tests done. Let's see what's happening here. But you're saying, Layla, because you were young, and at what time what was your age at the time that you were diagnosed?
I had just turned 19.
Wow. Yeah. So you were 19 and you're going in there and you're presenting with these high blood pressures, and they're kind of like disregarding. Did anyone ever, because I can't remember if you said that, did anyone ever state to you that maybe you're having a panic attack or anxiety?
Actually, no, which was a huge surprise. I hear it all the time now that I'm trying to get more help. But at that time, I think when they just saw my blood pressure, there was like, there's no arguing, because it was very, very high. Now my blood pressure is lower. So they're saying anxiety and all that stuff.
Wow. Wow. So I'm going to thank you, Layla, for sharing that. And please, I want to thank everyone for being here. Please put your questions in the chat for any of the panelists on. Some of you might even identify with someone on the panel. So please don't hesitate to put your questions in the chat. So Dr. Shauna, I'm going to give you that same question. did you ever feel misunderstood by the medical community? And how did this impact your care, your diagnosis time, and access to your research and treatment?
Yeah, it's a great question. And so, of course, the answer is yes. And I wonder if the answer to that is yes for all Pheo Para patients. And it may be, I don't know. But sure, early on throughout my life, I remember going to the doctor, telling him I had these symptoms, heart palpitations, really fatigued all the time, just for no real reason. My blood pressure was always really low. Now that's an odd thing, because we know Pheo Paras cause blood pressure to go up. So
Right.
because
Exactly.
my blood pressure was always low, although there are some conditions that you can have that will actually cause your blood pressure to be low, even though you have one of these. And if you didn't see any of our webinars yesterday, I'm going to put a plug in, go watch some of those, because we did have a couple docs talk about that. But because of that, I think I was definitely not taken serious. I can't tell you how many thyroid tests I had. And they kept saying, oh, I think it's your thyroid. Well, the test would always come back negative. Like my thyroid was perfectly fine. That wasn't it. So I was very misunderstood. I felt I wasn't listened to. And I would also add to this, I think for certain doctors that I saw, it was my gender, because I was a woman who was very educated. I knew a lot more about this particular disease than probably they did. I think I was probably very intimidating to them, and therefore I was dismissed very quickly. And absolutely was told that I think you have a panic disorder, which I knew I did not have a panic disorder. I'm about the most calm person that you ever want to meet. Like I just don't get too anxious over anything. Except for when I have a bladder para, then I got a little anxious every once in a while. Right.
Of course.
So yeah, I mean, I think I was definitely misunderstood. And I think because of that, it did prolong my diagnosis over years. I mean, I can look back and probably I had my tumor for almost 20 years, probably.
Oh, wow.
So that definitely does occur. Now I can also say, so gender, I think, played a role. Age at the early part of this, because I was a young adult. As you know, I was very young. Matter of fact, I may have been Layla's age, 18 or 19, when this kind of first started. I probably manifest, and I wasn't taken serious. So age,
Wow.
probably. As I started to have to go to the emergency room and see a lot of doctors, and that doctor wouldn't help me, so I'd go to another doctor. And again, because I was educated to say, hey, if you're not helping me, I'm going to go somewhere else. But along the way, so I also represent the LGBT community. And I do think that there were some docs that would, once they found out that, oh, this is my wife, it was like, oh, I can't help you. And I believe that I could probably identify a couple of docs that had an issue with that. And instead of them taking their oath seriously and helping everyone, I think that they figured out a way that they could say they didn't know enough about this, so they didn't want to research anymore, and they just didn't want to help me. So I do think that we have to, this is why this is very important. And I'm going to commend the Pheo Para Alliance for taking on this challenge of inclusion, diversity, equity, and accessibility. I think this is something that we have to consider to make sure that all patients are seen for their symptoms, and we don't look at these other caveats, I'll call them, that those things shouldn't matter. We should be looking at the patient for their symptoms and trying to help them for what it is they're presenting with. So yes, the big overall answer is yes.
Absolutely. Dr. Shauna, thank you. And that right there, when you said you are representing the LGBTQ community, we know that is one of the problems within our society, period. So we know that is definitely a determining factor as to disparities moving forward. And then to have a rare disease on top of that, that's definitely something that's a huge issue that we're dealing with. And that's something that I'm thankful that we are on this panel having this discussion. And I'm thankful, like you just said, the Pheo Para is recognizing that we definitely have to bring the necessary conversation and bring awareness to, as this pertains to people with rare diseases and marginalized people and communities. So moving on to Tina. Tina, you shared a very, very touching story with us in reference to your mother and as being a caregiver. I'm going to ask you that same question. When you were caring for your mom, did you ever feel misunderstood by the medical community? Because I know you had to take on a lot. You and I think it was your sibling.
Yeah,
Sister?
yeah, my younger sister. So my mom lived in Tasmania in Australia, and so during her whole like presentation and diagnosis, I was here in the States, and so I would video conference in to the meetings with her physician. So when she had her abdominal discomfort, a mass was found. It was about just over 2 centimeters near her aorta in her mid to upper abdomen. And we were referred to an oncologist, and in all honesty, this was the very first question that we were asked, my sister and I. So our mum came in. I was there on the video, my sister was there, and the very first question was, "Why are you here?" Which I thought was a really unusual question. It really took me aback because obviously we had been referred there because my mom had an abdominal mass. She'd had at that point an ultrasound and a CT showing that she had a mass. And I honestly, I was really quite surprised. I didn't think that if it had been me presenting as myself, an able-bodied person, that I would have been asked why I was there. So I took a breath and explained that, hey, my mom, yes, she can't communicate verbally, but she has been experiencing abdominal pain. They found a mass, and we currently don't have a diagnosis. Actually, the radiologist who had read out her CT scan actually had paraganglioma as the very last differential. So good for them because it was on there at least. But her top differentials was an enlarged lymph node with probable lymphoma. They were wondering about the possibility of a GIST that we just couldn't see attached to intestine in the region. And at the very bottom was the paraganglioma. So I explained, we were there to get a diagnosis because all we knew at that point was it was a mass. We didn't know what our options were. And the follow-up question was, well, why do we want to do that? And I was like, what? What do you mean? What do I want to do that? And the follow-up question for that was, well, is it because you just want a prognosis, or are you looking at treatment options? Because I'm not sure your mum's and they followed that with, I don't think your mum's necessarily a candidate for treatment. And I'm like, well, we don't know what options there are without a diagnosis. So until we actually have a diagnosis, yeah, we want to know prognosis, but she's as able-bodied as anybody else. Apart from her high blood pressure, which we didn't know was related at the time, she was otherwise physically great. She'd had a surgery a year prior. She'd had a rectal prolapse that was affecting her quality of life. And so she'd successfully had a surgery for that the year prior and had no issues in the hospital. We had one of her caregivers spend time with her in the hospital. She was never alone at any time. It went great. And so I was really, really surprised. And I left that meeting very unfulfilled as a caregiver and a daughter and a person in general. I just felt like she was 100% treated differently. And that was just the beginning of our journey. It went on a little bit more than that. But essentially, we were bounced backwards and forwards between a surgeon and oncology because no one wanted to try and do anything to make a diagnosis. The oncologist had suggested just removing it surgically because it was in a position that wouldn't enable an aspirate. We shouldn't aspirate paragangliomas and pheochromocytomas, but at that point, that was one of the options. And so we'll bounce backwards and forwards between them and surgery. And the surgeon was like, it might just be fibrosis. I don't even know if it's a tumor. And I'm like, well, that's ridiculous. Because at that point, we'd also had she'd had a PET scan, and it lit up like a Christmas tree on the PET scan. No other masses were found. And the surgeon was trying to say, well, I saw someone once who had fibrosis in that area. And it's like, well, that's just silly. Like, that doesn't light up like a PET on a PET scan. That's just not right. So in the end, no one wanted to do anything. You know, the recommendations was to just wait and see, that maybe she was better off just letting her live out her days as she was.
Oh.
I kid you not, it was
Wow.
mind blowing. So long story, very, very short. I wrote a letter of complaint to the CEO of the hospital that she went to. And at that point in time, the CEO was in transition. And so it was someone who was standing in as the CEO of the hospital. And 21 days later, I knew that they had received the letter on day one, because I contacted their assistant, who confirmed they received the letter of complaint that said that I felt my mom was treated differently because of her disability, and she wasn't offered the same diagnostic process as any able-bodied people would be. And she didn't reply. And so 21 days later, I thought, you know what can I do? So I wrote a letter to the Minister of Health in the state that my mum resided in, and detailed all of the conversations, copied in conversations I'd had, the copy of the letter I'd sent to the CEO. Within a week, he had replied and organized her plasma metanephrines. And so that showed that she had double the noradrenaline and, well, you guys don't say adrenaline, you guys say epinephrine. So she had elevated epinephrine and norepinephrine levels, like over 2 times normal, that was suggestive that it was actually a paraganglioma. And then she had, within a week after that, another additional specialized scan that highlighted it again, lit up like a Christmas tree, as we'd expect for a paraganglioma. But at that point, they also discovered a hidden brain tumor that we didn't know about. But it took a lot for her to get what I felt, for anyone presenting with a mass and a history of abdominal pain, the type of diagnostic process that I expect anyone and everyone should receive. And honestly, she didn't receive that. And it was very hard. I nearly lost my mind during that period.
That was a very long process for you as a caregiver, and just being her daughter. You took on a lot, and I'm listening to you, and you just have all the medical terminology down. I don't know how you dealt with that and caring for your mom, because I know it had to be very emotional. Would you say that because of the disabilities that she had prior, that's all they connected with, basically, and her age? Because when you said that you felt as though they just wanted her to live out her days, that to me is horrifying.
And honestly, she wasn't old at the time. I think she was about, she was in her early 60s at the time.
Oh, that's young.
The exact age, but she was in her early 60s at the time. And all they could see was her disability. And that, it just felt to my sister and I and my family that all they could see was her disability. And then there was this judgment of what they felt like, what her life should look like. And, some, without even knowing her, like, judgments on what they felt about her quality of life. And she had a wonderful life. I mean, she was very active at the facility that she lived at. She helped out with other patients. Everyone used to call her mama. She was wonderful. She used to win all of their, she used to play bowls. So she used to win all their bowls competitions, and she'd come visit us on holidays when we were on summer holidays and things like that. And I mean, it was hard as the daughter who loved her mom, to see someone put their own judgment on what her life was and what that meant. So yeah, it was really hard.
So Tina, thank you so much for sharing with us. That definitely, I mean, each one of us as panelists have been through some really challenging situations, as you see. And again, I can't stress enough for people. I see some people putting some questions in the chat, and that's awesome. I'm going to move on to our next question. And this question is more so focused to Dr. Gabriel in reference to the medical community. And how do you feel rare disease organizations can reach out to more diverse patients to capture everyone, to make it equitable, you know, as it pertains to, especially as it pertains to rare diseases? As you are listening to these stories here with us, what's your thought process, and what could you add that you think the medical community can do?
Wow, that's a loaded question, Saadia.
I know. I gave you a lot. I gave you a lot.
Yeah.
Let's pick it apart. Pick it apart.
Yeah. So, fortunately, in my training, I've been at institutions that are kind of big and have a lot of resources. And so I think one of the main issues, and this is not a problem I know how to solve very well, but I think one of the issues is not every hospital is going to have that, right? A rural hospital, places that won't have specialists, things like that. And so a lot of specialists tend to gravitate towards large cities and things like that. That's just kind of how, people set up their lives. I am very much involved with advocacy through the American College of Surgeons. But my role is really limited within Florida right now. So I am on the governing council of the Young Fellows Association, which is kind of like, we're not that young, we're in our 40s, but it's good. I mean,
You're young. You're young.
That's great. But we meet with local politicians, and I can tell you, I've met with John Rutherford. He's one of the district congressmen here. You can't always get with the governor or like senators. Usually we meet with their staffers, right? So we meet, like, they're too busy doing whatever it is they do. So we meet with their staffers, and the ACS has an agenda. We have an agenda. Part of it is addressing disparities. I mean, that's a huge thing in all healthcare organizations. I don't know that I have a good answer for you guys. It's a very slow process. Listening to Tina's story, there's so many things I wanted to say about, like, how the training is different, like how I approach my patients. Like, I would never ask those questions, right? I mean, it's just, I already
Then
know.
Dr. Gabriel, how would you have approached Tina's situation? Please share with us.
Yeah, so I mean, if it's okay with you, Saadia, like, because I'm glad you mentioned that I operate on you, so I didn't violate any HIPAA, so it's all, it's all.
No. Please share. Absolutely.
I think if you recall, when we actually met via Zoom, because, like you said, during the pandemic and the distance, but I already knew everything that was going on. So I kind of, if you recall, I kind of confirmed some of your symptoms, some of your diagnosis. I already knew the labs, and then I just went into the treatment options. So that's kind of how I do it with most, if not all, of my patients. I'm fortunate in that when patients come to me, the diagnosis is like 95 to 99% already established. It's very unlikely that you're going to come to me without a diagnosis. There are some patients I have that, and then I lead them down like biopsy or things like that, but that's very uncommon. So I'm not sure, Tina, was the person, it sounds like you mentioned a medical oncologist, like maybe he or she was in charge of the workup, and maybe, that was their approach. I very rarely do that. I already sort of pretty much know, like, what to offer the patient. I do have to weigh the benefits and risks, like we talk about that, make sure they are a healthy candidate to survive the surgery and things like that, and there could be complications. So we do have an obligation to weigh those benefits and risks, but it's usually, that's kind of, I'm in a particular position where that's that burden, so to speak, is kind of put on other doctors, like the medical doctors and things like that. So I can tell you our endocrinologists are very good. I think Dr. Saadia met Dr. Rao, who is very good. I have met African-American patients that were treated in other facilities, like you were saying, they had a location by the aorta and they thought it was, who knows what it was, and we figured out what it was and treated the patient like very quickly, but that's really, I think the answer to the question is so loaded because it really drives towards how resources are allocated in the country, trying to help those who don't have the same equity, and really shifting the resources there. And that's through grassroots. And that's what I try to do in Florida. I do feel like I have a voice in Florida, but it's a very slow process. You can imagine meeting with some of these folks. I mean, sometimes they don't show up to the meeting. Like, they don't even show up to the meeting. Like, we schedule these months in advance. It's me and other surgeons, other leaders at other institutions within Florida. And sometimes just with the staffers, and they don't even show up. So it's just kind of, a bust. If I may, one of the people who joined the panel, Tammany Yeager, I did not know she was joining. She is actually one of my residents.
Oh,
Yeah,
wow.
who went on to do an endocrine fellowship. This is not planned. She just showed up. I started texting her. I was like, "Oh, last one's the past over here." But she went to Mount Sinai. She was one of our excellent residents, and she's starting in Georgia. She's in Georgia now, full-fledged, physician, surgical endocrine surgeon. And so this is something I try to instill in the residents to get involved with, these programs early to advocate for patients, because my mom had a horrible situation. It wasn't Pheo Para related. It was cancer related. I think Tammany knows, I was gone from Mayo Clinic for weeks and months at a time, trying to guide her care, Memorial Sloan Kettering. And I felt like, and I have a very, medical training, and I felt like they weren't really addressing the situation. So I sort of know kind of that feeling. It's a horrible feeling to feel helpless, to feel powerless, to feel like, you're giving yourself to someone who's supposed to help you.
Absolutely.
It's not a good feeling. But yeah, that's all I can say. But yeah, I just wanted to, let you guys know the Tammany's here. She also specializes in this. And please bear with us. There are surgeons, there are physicians who are, I meet with the Congress people probably twice a year to try to make changes like this.
Well, Dr. Gabriel, you are just amazing and awesome. And I truly am so blessed to have had you for my surgeon. And I still have a great rapport with him, as you see. So I'm definitely thankful. Thank you, Dr. Yeager, for joining us as well as being, so you're a surgical endocrinologist. Is that okay, great. Great. So we thank you for joining us as well. So of course, like I said, keep pushing those questions in the chat. I'm going to go ahead and move on to Dr. Snyder again, because Dr. Snyder, you have a very, you have two roles here. So you're a patient, but you are also on the Pheo Para board, right? So I would like to know how you feel, same question, rare disease organizations can reach out to more diverse patients. How do you feel? What do you feel like the board has in place?
Well, I think simply through our social media, we do great with reaching out. We have a Facebook page, we have an Instagram page. I think we're working on a LinkedIn. What else do we have? We may have one other thing I'm not thinking of. So I think we do a great job reaching out to patients there. I think this awareness week is a great way for our patients to be engaged and to learn. Our conference, which is going on this week, if you haven't joined in on that, definitely, it's a great way for our patients to be engaged. And I think one of the things that you're gonna find is that there's no discrimination here. It's open doors, because the thing about a rare disease is it can happen to anyone. So, as we've heard people's stories here, that, this can happen to anyone. We have a certain percent with Pheo Paras that, yes, there's a genetic link, but there's also, and my numbers are missing my head right now, I want to say it's 40 to 60% have no genetics for this. I don't have any genetics. Layla has said she doesn't have any genetics. It's
neither do I.
So there we go. So
I still have symptoms after. Yes.
So of our panelists, there's no genetics. So so we can't discriminate by saying, oh, well, it's only going to happen to these people, or as an organization, we have to understand that anybody could potentially get this, and we need to raise awareness about that. We need to raise awareness that anyone can get it, what the symptoms are, where are great places to be treated. We have some centers of excellence that if you're in the process of thinking you have one of these, you have the symptoms, you're trying to be diagnosed, we highly recommend that you try to get into one of our centers of excellence. So those are out on our website. So definitely try to, get out there and visit our website. And as a board, for a board member for the Pheo Para Alliance, is very important that we have a committee that addresses IDEA. IDEA. It's very important to us because we definitely want to make sure that all people are treated equally, justly, and that we reach out and help anyone and everyone who is a patient and or a caregiver. And I'm going to add a physician. We have physicians that will sometimes reach out to us because sometimes this is a new area for some physicians. They don't, many physicians will never see this in their entire life. So we want to also help physicians who may have a new patient or maybe trying to learn more about this. Did I answer your question, Saadia? I hope I did.
You absolutely did. And I also wanted to just say, does the Pheo Para organization have any measures, including the training, to address those ethnic and racial disparities in treatment, you know, for especially the BIPOC community? And that can also go for Dr. Gabriel as well, because I did not ask him that. And even if Dr. Yeager wanted to chime in, because I know she deals with a lot of the patient community.
So our board is getting ready to go through some training. I know we have that on our agenda, so we're getting ready to go through some training as board members. So, you know, those of us who are board members as volunteers or on staff, I think we're in the process of getting that all set up, as I hope most hospital systems, you know, doctors' offices, I hope that is something that people seek out, even if it's not in their institution. I hope they seek out that sort of training, you know, just to make sure that you know, have that language. There
you go.
And, you know, you need to understand. You need to understand others. You need to understand empathy. There's a lot of things here that we could kind of peel back the onion. And I think training helps us to learn those things.
Yes, absolutely. I like that you said understanding the languaging and then understanding one another, because communication is key as it pertains to IDEA. And I think that's where we kind of flaw one another, because we may not understand each other culturally. Everyone has a different, has been brought up differently. So I think that when we have that conversation and we start to communicate with one another to understand, not to judge, but to understand one another, I think that will be key, a key factor as to how we move forward with the progression of IDEA, right? So thank you so much, Dr. Shauna. Yes, you definitely hit it on the nail. Before I go back into that question, there is someone that wants to ask a question. Go ahead and please allow, I think it's Miss Kiki. Miss Kiki has a question.
Hi, I didn't have a question. I just wanted to address Dr. Gabriel and tell him thank you, because I am Saadia's cousin, and I traveled with her to the Mayo Clinic for her surgery. We had a rough time getting there through the airport. We had a whole bunch of obstacles, let's just say that. And through it all, I prayed and I asked God to give me the strength to be able to be there for my cousin, who is my sister, not just my cousin. But I wanted to say the Mayo Clinic staff, and especially Dr. Gabriel, reassured me during the process. Like, I did not feel like I was in the dark at all. He even drew a diagram for me and explained to me, because I don't know if he knew or not. I really wasn't sure what this was when she, you know, told me about the situation and I asked to go with her. I still was not sure what this condition was or what it entailed or what the surgery was going to be about. And when I say this man came out to the waiting area with his pad and pen and drew a diagram, which I saved, and showed me where he had to operate, what he had to operate on, reassured me she was okay, they got it, just explained in such detail with such compassion and such grace, if you will. I just wanted to take this opportunity to thank you, because you have no idea how that soothed my mind, sitting out there waiting and not knowing, and, you know, what am I going to tell her husband and her children if this doesn't go right? So I really greatly appreciate you. And when the question was posed, what could you do differently, Dr. Gabriel, as far as, from my perspective, being a caregiver and someone who accompanied someone with this condition to the hospital, you did an excellent job. I don't think there was anything I would have asked for on my end of it from you that you could have done differently.
Awesome.
I wish I can share. I'm getting goosebumps. Thank you so much, Kiki. That means so. So I'll say, you know, I remember your surgery. I did not enjoy your surgery.
He said that to me. He told me that.
I'm pretty straightforward. You know, it was in a dangerous location right by your kidney veins. You know, I did not enjoy it. It's very stressful, you know. But what's not stressful is taking care of patients like you. So I'm fortunate to have a lot of kind patients, you know, grateful patients. And it's so easy to take care of patients like you. It's just a pleasure. Thank you very much.
No, thank you, Dr. Gabriel. And absolutely, I will share the same response as my cousin Kiki. Thank you for coming on. She's like my sister cousin, I call her. And I'm thankful that she was there. That's what I'm saying in reference to resources and having the family and friends to support you, because a lot of people that are dealing with IDEA, they don't have family and friends like my cousin Kiki or like my surgeon, Dr. Gabriel. They don't come from those type of resources. They're lacking. And that's why we're here. That's why I'm thankful that the PPA has decided to have an IDEA committee to really divulge into the patient community how they can take care of being making sure that they're inclusive, you know, that everyone has fair health care and resources across the board. You know, equity is important. It's very important. When we talk about the rare disease community, they say, and Dr. Shauna, you probably can give me the numbers, 25 to 30 million of us have been probably pronounced like we're acknowledged, maybe 25 to 30 million of us. Do I have those stats right? Or am I kind of off?
I'm not sure. I'd have to look those up.
Okay, I was trying to do look, Dr. Shauna, I was trying to do my research.
I don't know it either.
Okay, so I'm just saying that amongst in this community, especially the rare disease community, there's already marginalization there as it pertains to the disease that we carry or that we've had to journey through. So imagine not even having, you know, moving forward and trying to get the acknowledgement from medical in reference to like Layla, what she was experiencing, her age, Tina's mom, you know, what you had to experience, what I had to experience. So I definitely think IDEA is necessary moving forward. So I'm going to go ahead and get into another question. And then I want to have some time to take questions from the audience as well, if that's okay for the panelists. Are y'all ready to take some questions as well from the audience? I just lost my train of thought. That never happens to me. So with grace, bear with me, with grace, I would have to ask Layla, I'm going to ask this question to everyone, Layla, Tina, and Dr. Shauna, you know, moving forward as a caregiver, as a person, as patients dealing with this, how do you feel we need to move to bring about this awareness? I'll address it to Layla first. How do you feel we should go about bringing this to our communities? Because we might have faced discrimination amongst the medical providers and in the hospital, but what about our families? How many of us had to explain the situation to our families and friends that may not have totally agreed with us? You're not feeling well. and you're telling them what your diagnosis is. And, you know, they're making it seem as though like you're making excuses when you don't feel well, when you don't want to go to that family or cannot attend that family function. So that's, you know, it's a lot that you're facing there, but between both sides. So how do we bring about the awareness for rare disease so we won't be so marginalized? And we can come out and we can talk about these things and say, listen, this is an issue in our community. You know, what do you think, Layla? And what are you doing currently?
Yeah, that's a great question that I wish I had the answer to. But I guess off the top of my head, I know we have pamphlets with information that goes out to the newly diagnosed patients with the care packages. So that might be good to get out to kind of healthcare providers or facilities that don't necessarily have a big population around them, like in small towns or even other countries that might be smaller and not having a lot of Pheo knowledge. I think just spreading that knowledge with them, even just through a pamphlet or an email or something, would be helpful. As for family, that's something I struggle with a lot. I think it's so hard to explain the severity of it and how much it really impacts you. I don't really have an answer because I still struggle with that a lot, but I think just trying to just explain, sometimes using analogies helps, like saying it's not that I don't want to do this thing, it's that it'll cause these symptoms for me. And trying to explain it in that way can be helpful. But it's very hard to get people to understand. Even I don't understand it sometimes, so it's very difficult.
Well, thank you, Layla. Thank you for sharing that. I'm going to move forward to Tina.
Hey, it's such a complicated question. I think honestly, having the idea committee and discussions like this is the first step. I think hearing people's stories, and I think, like, you know, just listening to Layla and yourself and Shauna, like, I feel for you when I hear some of those stories in terms of how you were treated based on either, you know, race or age, ability, sexual orientation. Like, I think having our community share some of those stories, and then, as Shauna was saying, education, I think, is key. So having training in how to help recognize these things. I think definitely building relationships in the community. Like, Dr. Gabriel sounds amazing. I don't know if he's still on or if he had to leave, but having relationships not just within our community, but then also within the medical community as well. And as a whole, I think we're going to help solve some of these issues. I don't think that there's a one-step way to like fix it. It's so multi-layered, and as you were talking about, like an onion, there's many layers to it. But I think definitely supporting one another, listening to one another's stories, and then holding hands together and taking incremental steps forward to try and help change both. It's multi-layered, right? So it's not just you know, the medical community, it's just the community in general and how the community in general sees people.
Absolutely. Absolutely. How community sees you as a person, an individual. I think that has a lot to do with it. And that's the reason why I asked this question, like, what can we do differently in our communities especially as it pertains to marginalized people. And because we have this rare disease, we are in a marginalized community. So yeah, absolutely. Dr. Shauna.
That's a really good point. And I liked how you just said that because we have this rare disease, we are a marginalized community, you know, and I don't think that maybe sometimes we don't put our own mind around that. I don't think until you said it just like that, it hit me exactly that way. But, you know, we are a small, rare community that people don't know anything about us. And so sometimes when we don't know something about someone else, or we don't know something about their culture, or we don't know something about their experience, then oftentimes we get a little bit taken back, or we might want to, you know, not associate with that because maybe we don't know, or maybe we're afraid of it, or, you know, whatever. There's multiple reasons. So it is very complex. But, you know, so I think continuing to educate ourselves, continue to educate others, even continue to educate your doctors. So this week I'm going to send out, it's over in our chat. We have an education packet for, it's called Challenge to Change the World. I'm going to send that to all my doctors. Even though my doctors know me, they know that I have this. I have some doctors that I still see that actually have started seeing me after I got my surgery. So they didn't see me when I was at my sickest, right? When I was at my worst. They didn't know me then. They didn't see me when I was going through symptoms. They've seen me since then. So I want them to know a little bit more about that. So I'm sending that to my doctor. So I think that's one thing that we could all do. And I know we're short on time and we're getting ready to go, but the other thing that I would also recommend is if you are a person who needs that support, we have peer support groups. So the Alliance PPA, we have support groups. I believe right now they're happening once a month, but if you get out on our website, you'll find it. But they're peer support groups where you can talk to other people, whether you're a caregiver, whether you're a patient, and even different levels of patients. You can feel supported, and that alone, you know, I think helps all along the way. So keep that in mind. You know, I know some people have kind of left, but those of you who are going to watch this on a video later, all right, keep that in mind. Okay.
Thank you, Dr. Shauna. Definitely, please sign up for, you know, those meetings, because that's necessary. I'm definitely going to sign up. I believe one of the patients that I met, she's in the social media group, Miss Underwood, or Miss Sandra Underwood. She told me about that. I'm not sure if she's up. I think she is up here, but she did tell me about the meetings. And I definitely want to sign up. I think that's helpful when you have other people that are have been through what you've been through, or going through what you've been through, so that we can all kind of lift each other up. That is very important, you know, motivating one another through a challenging time. You know, we can all get through this together. And that's very firm. I hold that firm to my heart. I don't feel as though that we have to look identical to one another. No one's going to look completely the same. And we can still support and uplift and elevate one another. I'm going to go ahead. I know it's time for us to close out. I definitely, rare but not alone. I love that, Layla. Rare but not alone. I love that. She put that in the chat. I was trying to look at the chat and focus on everyone on the panel as well. And yes, Dr. Gabriel had to leave. He was definitely working, but we definitely appreciate him being here and just giving his insight. So I just want to say that on our record. Thank you, Dr. Gabriel. When you come back to listen in, we appreciate having you and Dr. Yeager here. Stephanie has put in the chat a link to the Pheo Para's organization, the Community Peer Support Group. So please take a look at that. It's in the chat right now, the pheopara.org Community Peer Support Group. You can go ahead and snap that or screenshot it, whatever you need to do to get that information. And I'll take any more questions from the audience. If you have any, please raise your hand. Anyone out there? I know there was a question by Thomas in reference to how you would support someone with a Pheo, and I believe his question was answered. So if you have anyone, a family or friend that's going through, has a Pheo or a para, you know, there are so many resources that the Pheo Para organization definitely has. And there are definitely some social media groups that you could look at. Social media is huge. I mean, you can use it for your good. Definitely look up pheochromocytoma or paraganglioma support groups on social media, definitely please register with the PPA, that's the Pheo Para Awareness Association. Please register with them just so that you can get those resources. I would tell you, when I first found out about PPA, they sent me a toolkit in the mail, and I loved it. It was beautiful. I felt like I was alone until I saw them. I was like, oh, there are other people with this. I was thinking, you think like, huh, I'm the only one going through, but no, I was not. And I realized that there was a whole community out there that also was going through what I was going through, but there were also resources. And I shared that with my doctors. So I'm definitely giving out, like you, Dr. Shauna, just giving out those resources, this helpful information about PPA. And I just want some closing remarks from my panelists. And then we're going to go ahead and close if no one has any questions. So I'm gonna just something short, a snippet of inspiration from each one of my panelists. What would you say to someone that you just met that's going through what you currently had to go through, either as a patient or a caregiver? I'll start with you, Dr. Shauna, to uplift them.
You are not alone. I think that's a good thing for people to understand. You're not alone. There are others who have gone through this. Reach out, talk to them. They're going to give you lots of helpful tips and tricks, from everything about, it's okay to fire your doctor to drink lots of water, right? I mean, there's all kinds of tips and tricks that people are going to tell you who have been through this and they've walked in your shoes.
I love that. Thank you so much. Tina?
I was just nodding a lot with what Shauna said.
I like that. It's okay to fire your doctor.
I know. I'm like, yeah, it is. I just want to reiterate, you're not alone. You're not alone. We all come from different backgrounds and we're all here to help. And if you need help, then just reach out and ask.
Absolutely. You're not alone. Layla?
Yeah, that is pretty much spot on, is that you're not alone. And I don't know how uplifting it is, but just remember that you need to advocate for yourself, because especially with a rare disease, no one is going to do it for you. And it's hard, but you can, like you guys said, you can ask us for help. We're always so many different resources and we're always here to help. And of course, you're not alone.
Absolutely. I love that. So everyone listening out there, you are not alone. If you know someone that has a rare disease, or is just someone that has a disease, period, please let them know, show them the support, the emotional support is necessary. And if you know of resources, give them those resources. Not everyone has the technical skills to research, and they may not have some people in their community, they may not have what we have. So if you have resources, spread the awareness, give that information out. Don't be shy. Please continue to support and join into our community, our peer support community. And I'm going to get ready to close out. This has been an amazing panel. All of us superheroes have united here today, and I'm so thankful for all of my panelists. You all were beautiful, awesome, and amazing once again. I just wanted to tell you thank you for your time, especially sharing your stories with us. We definitely appreciate you giving us that heart in you. That's personable, and you share that is so valuable, and I thank you for that. A special thanks again to Progenics for supporting us, the third annual awareness week. So special thanks to them. And I just want to let everyone know that this session will be available for viewing on this platform. Okay, and don't forget to tune into our conference sessions. We have more all this week. Check out our Facebook page, all of our social media pages, Instagram. We're on there. PPA is on there, and you can access it at any time. So I'm thankful for all of you. Thank you for sharing, And to all, a good night. And as our superheroes unite, I'm flying off, y'all. You see my cape? I'm flying off. Awesome.